HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to the acquired immunodeficiency syndrome, also known as AIDS, if it's not treated. Unlike some other viruses, the human body can't get rid of HIV completely, even with treatment. So once you get HIV, you pretty much have it for life. And HIV is a virus spread through certain body fluids that attack the body's immune system, specifically the CD4 cells, also known as T cells. Over time, HIV can destroy so many of these T cells that the body can't fight off infections and disease anymore. And eventually, that's what gets you, not the actual virus. It's the disease that you may contract due to your immune system being very low. And these special cells, the T cells, help the immune system fight off infections. And as I said, untreated, the HIV reduces the number of the cells in the body, and it makes it harder and harder for the body to fight off the infections. So therefore, really strong infections or viruses or even cancers take advantage of the very weak immune system that an HIV infected person might have. And yeah, and although there is no cure, no 100% cure for HIV, there are many treatments. One of them is antiretroviral therapy, also known as ART or ART, and it is the use of HIV medicines to treat the HIV infection. And people on ART take a combination of HIV medicines called an HIV treatment regimen every day. And ART is recommended for everyone who has HIV. People with HIV are recommended to start on that ART treatment as soon as possible. Even though it can't cure HIV, it has been shown that taking this medication can help people infected live longer, healthier lives, and reduce the risk of transmission. The main goal of ART, or one of, is to reduce a person's viral load to an undetectable level. That means that the level of HIV in the blood is too low to be detected by a viral load test. And people with HIV who maintain an undetectable viral load have effectively no risk of transmitting HIV to their HIV negative partner through sexual transmission, for example. And before starting ART, people with HIV should talk to their healthcare provider or doctor about possible side effects of HIV medicines and potential drug interactions between the medicines or other medicines that an infected person might be taking. And I believe that overall, the benefits of ART or HIV medicines seriously outweigh the side effects. And in addition, these new HIV regimens or ARTs that are found today cause fewer side effects today than they have in the past. And another treatment for HIV infections is pre-exposure prophylaxis, or PrEP. And it is when people at very high risk for HIV take the HIV medicines daily to lower their chances of getting infected. A combination of two HIV medicines known as tenofovir and emtricitabine, which are sold in the drug called Truvada, is approved for daily use as PrEP to help prevent an HIV negative person from getting HIV from a sexual or injection drug using partner who's positive. And studies have shown that PrEP is highly effective for preventing HIV if it is used as prescribed. And PrEP is much less effective when it is not taken consistently. There are a lot of myths that the drug is toxic and that there are side effects, says Dr. Kevin Rebe, a specialist medical consultant for Anova Health Institute. And Dr. Rebe runs a small program offering PrEP to men who have sex with other men in Cape Town. And side effects are only present in 1 in 10 patients. And However, the drug should not be taken lightly because it is very strong, as some patients have experienced moderate declines in kidney function associated with higher doses and older age, according to 2 major studies presented at the recent conference on retroviruses and opportunistic infections. And there are many controversies surrounding PrEP because a lot of sex workers are using it instead of condoms, which has a lot of controversies because in some places it is not offered to these sex workers, and because of their jobs, as some people protest that these kind of non-ethical jobs are being offered medication that someone who's someone more traditional or more kept might be rejected from using the same medication. And the thing with the controversies with sex workers is that they're having sex without condoms because of PrEP. However, as I said, PrEP is not 100%. It's not preventable for the HIV, and however, the blunt truth is that people are still having sex without condoms and using them inconsistently, and this inconsistency is enough for HIV to be transmitted. If this wasn't the case, then new HIV infections wouldn't appear. And a lot of people like to think of PrEP as birth control because as it doesn't prevent women from contracting infections or HIV, but it does prevent them from falling pregnant. However, as I said, PrEP won't reduce the risk of contracting STIs or infections, but it will reduce the risk of HIV.